Now that school is back in session, so are fall sports, which means an increased chance of concussions for student athletes. And UofL Health's Dr. Carrasquer is here to talk about precautions that we need and what protocols should be in place if there's a concern that a student is hit in the head, maybe suffering a concussion. So, Doctor, thank you so much for being here, because this is a really important topic. It's talked about all the time. You know, we hear about the NFL, but this happens a lot in high school and middle schools now.
Absolutely. Thank you for having me on.
Yeah.
It is something that we deal with, and especially this time of the year, with football and soccer season starting. So it's definitely a good topic to discuss.
So tell us what some of the common signs and symptoms are of a concussion.
Sure. There are a variety of symptoms that athletes may experience after a concussion. Most commonly, they complain about nausea, dizziness, headaches, sometimes sensitivity to light or sound, experience fatigue, irritability or mood swings, which obviously in our teen population can be something that we just see commonly. But yeah, in school they may have trouble with concentration and things like that.
Right. Now, how is the decision made for when an athlete can return to play? Of course, we've seen in the NFL when some athletes get hit and it looks like they got hit hard in the head, and then they come back out and play and people are like, what are they doing? Absolutely.
So immediately following a concussion, we always recommend at least 24 to 48 hours of rest. That limiting screen time, social interactions can really help kind of calm that stimulation of the brain. We like to start our athletes on multivitamins if they're not already on one. Fish oil, omega-3s are great for brain recovery. After that, after the initial period, light physical activity is great as long as it doesn't make their symptoms worse. After their symptoms have resolved, which usually takes about a week or two, we start about a 4 to 6 day return to play protocol. We increase our level of activity every day, as long as they don't have any kind of return to symptoms, and at the end of the protocol, we get them back to competition.
And I'm guessing that a lot of trainers now with high school, even middle school teams, college teams, of course, are very well versed on concussion protocols.
Absolutely, absolutely, yeah. They're a main part of the medical team, and they're the ones that really are running the protocols, especially with our high school athletes.
Are there things that we can do to prevent concussions in the first place?
Unfortunately, the best way to prevent or reduce your risk for concussion is just not really be involved with contact activity or contact sports. Although we've made great strides in modification with our helmets, they do a great job in preventing serious brain injury as well as potential fractures, but don't do a great job in preventing concussions.
Wow.
One of the best things that we can do is really teaching and improving on our technique as well as game awareness, allowing the athlete to understand how to properly take a hit or perform a hit on another athlete. That's the best way to really reduce risk on yourself or other athletes.
All right. And of course, if parents want more information out there, they can always contact UofL Health.
Absolutely. We're here to help.
All right. Doctor, thank you for being here today. We appreciate it.